Hi, my name is Debbie. I'm the Serious Mental Illness Annual Health Check Champion. Welcome to this video recording. The purpose is to improve the understanding of reasonable adjustments for those attending their SMI Annual Health Check. And the main areas of focus are why we need reasonable adjustments, some examples, and the aim is to make the appointments more flexible and accessible. And this video aims to be quite short and informative, offering some practical tips for you as busy professionals. So in a nutshell, reasonable adjustments are just small changes that can be made to ensure that services are more accessible, and that will help to reduce those health inequalities, supporting patient-centred care and improving engagement. Those with a serious mental illness such as schizophrenia, bipolar disorder, psychosis experience the greatest health inequalities. Life expectancy is 15 to 20 years shorter than the average population, and sadly the majority die from preventable illnesses like cardiovascular disease and smoking related illness. As you perhaps know, every year those on the SMI register are offered a health check, and this can be a good opportunity to discuss physical health, goals relating to movement and fitness, offering ongoing support through, for example, social prescribing to help with that prevention of those long-term conditions. So what is SMI? SMI refers to any mental illness that is debilitating enough to have a significant long-term impact on that person's ability to engage in functional or occupational activities. The SMI health check covers 6 core elements, but we aim to complete an enhanced health check to include a conversation on nutrition and diet, physical activity, cancer screening, assessment of illicit substances and a medication review, and a completion of a health action plan addressing the biological, psychological and social factors. So why do we need reasonable adjustments? The Equality Act requires us to make reasonable adjustments or small changes for disabled people, including those with serious mental illness. SMI can affect motivation, cognition and functioning, and that can actually make it harder for them to engage with services. Without these adjustments, we risk excluding the most vulnerable people who need the most care. So our goal is to remove any barriers and provide that compassionate, tailored support. So understanding the challenges can help us to provide a more inclusive service. Many living with serious mental illness struggle with planning and motivation and memory. Some may fear being misunderstood or judged, and they may have a mistrust of services. Also, practical barriers like transport issues or needing someone to come with them to the appointment might impact on their ability to attend. Feeling overwhelmed or anxious can prove challenging, and the time of appointment might clash with medication side effects, for example, feeling drowsy in the morning. And if that person has got poor mental health, they might not be prioritising the physical health, or there could be other lifestyle factors that are impacting, like substance abuse. Reasonable adjustments are small changes that can help the patient access their SMI annual health check. Send them a reasonable adjustment leaflet so that they can let you know ahead of the appointment if there's any changes that they need to be made. Adjustments should be meaningful and based on what works for the individual. Collaborating with the patient is the key, and regular reviews to ensure that we adapt to their changing needs. So some examples of reasonable adjustments. It could be that they need easy read documents. They might need longer or more flexible appointments. It may be that they want to bring a friend to a cancer screening appointment. They might get a bit nervous. They might need support with follow-up appointments. They may even need a home visit. So how do you know if someone has already had some reasonable adjustments recorded on the record? It's important to look for these things because we don't want the person to have to keep repeating themselves. But as I said earlier, it may be that they do need reviewing every now and then. So here's a screenshot. Look on the home page, the patient may already have that information. Adjustments are recorded as a high priority reminder. If you're actually adding information about a reasonable adjustment, look for the speaker icon that appears on this slide on the left-hand side, the bottom left-hand side. Look in the search bar, or you can just type in reasonable adjustment and the template will appear. On the next 3 slides, we've got how to record reasonable adjustments on EMIS. If this doesn't apply for you, you can just skip ahead to the next slides. So we've got a case study here. It's John, 42-year-old man, diagnosed with schizophrenia, living in supported accommodation, got a carer, Samantha, who goes with him to most of his appointments. He does find it difficult to process information and needs a little bit more time to understand things. And he sometimes finds it difficult with verbal communication and prefers things to be written down or some visual explanations, some diagrams. So it might be a good idea to just stop this video and just reflect on what kind of adjustments can be offered. Think about some adjustments that you've already made, maybe in the past. Could be longer appointments to allow for a slower paced conversation. In this situation, Samantha could attend the appointment to provide reassurance and to help to explain some of the information. And the clinician could use simple language and visual aids to explain the health check so that that person finds it easier to process things. The appointment could be arranged during a quieter time of day to reduce that sensory overload. In this scenario, what do you think the likely outcome would be if these adjustments were made? So, in this case, John felt more relaxed and engaged during the appointment. He was able to ask questions. He was able to understand his health needs better and agreed to follow up care with a little bit more confidence. So additional support may be needed to ensure that patients attend their appointments, such as proactively sending reminders. And with consent, there may be opportunities to liaise with voluntary sector organisations and multidisciplinary teams such as the ageing well practitioners, pharmacists, social prescribers, occupational therapists, community nurses, to provide that essential all-round support. And if you do find it difficult to get hold of people, they're hard to reach, then the message is really just to keep trying. Here are some links for some further reading. So reasonable adjustments are essential, and having those tailored approaches improves outcome for the patients. We're hoping to remove any barriers that mean that we can provide that more inclusive service. And the adjustments should be meaningful to that person and adapted to suit their needs over time, so need regular reviewing. And it's about working across teams with the different professionals within Pennine GP Alliance, but also voluntary sector, secondary care, and all those other services. So what do you feel that you can take away from this session? Is there anything that you can put into practice that's different to what you're already doing to improve the quality of the SMI annual health check? Just reflect for a few moments on any changes that you can adopt. Thank you for listening. Hope it's been helpful. If you would like me to come to your practice and have a chat with the staff there, if you've got new members of staff that are involved either in the invitation process or actually carrying out the SMI annual health check, please give me a call, send me an email. If you just want further resources and you want to read a little bit more or watch a few more videos, then I have got a Microsoft Teams channel that you can click on the link there, and again, I hope you find that helpful.